Good morning, everyone. As my name is Ethan Pang, as mentioned, from Nanyang Technological University. Very grateful for NUS involving all of us here. I think this is the first time we are doing such a conference in Singapore. It's many years coming, so I think this is a great opportunity for all of us to get together and to learn from one another. I think personally, after hearing Matt speak, I feel like I can go home already. You know, yesterday he visited us and I said that there's no better person in the room than he to tell us all about the Okanagan Charter and what it is about, right? And really, after hearing from him yesterday and today again, I grab him, okay? Grab him later when you can over a coffee or something, yeah. I have this topic, the path to systemic change. Not that we have achieved it, but I think what I'm going to share is really our journey. I will also talk a bit about personal journey to start off with so that you understand where I'm coming from. Diana mentioned that she is a 门外汉. I'm very much a 门外汉, right? Not a scholar, not a clinician, not a counselor, not a psychologist. And I came into this cold in so many ways. And I'll tell you how that came about in a while. I'll start with this. Several years ago, pre-COVID, I joined a social service agency to do some volunteer work. And one of the things that they do is, that time we were getting goodie bags. We go to door, and some of my team will say, that's where you get all your ideas from, in doing work in NTU. We get goodie bags, we go door to door, we knock on them, and that was about giving out stationery to families with kids who can't afford them, right? This was in Jalan Hosui, Bukit Hosui, Tiong Bahru area, all right? And so after all that work, knocking door to door, give them the thing, how are you? Here's a stationery pack for you. And then we went back, and then the social service agency briefed us to say their approach to their work. And the person he said that in social service and community service, the thinking is always from a service angle. If they need childcare, we think about providing a childcare service. You need financial aid? Yes, we have a center for you to come and apply and get your financial aid and so on, right? You need counseling? Yes, come. We have counseling for you and so on. But their thinking was a bit different, which was inspiring to me, because they said that, we are always coming from an angle of weakness of the community, that, they cannot do it themselves. That's why we have to come in. In many ways, that's true. But there are strengths in the community as well. And so what they did was, when they got their people, the residents from all these flats, to come together and discuss the problems that they had, they have solutions from the community. Right? So one of the example was this. In their group settings, their discussions, one of the days, I think, if I remember correctly, about 8 of them, one mother said that, low-income family, work part-time, gig jobs, so as and when they get caught up for work. And so this mother said, this is how my work nature is. So I get called and I have 3 kids at home, young kids, but nobody is there to help me last minute to take care of my kids. And guess what? In that small group of 8, someone said, I just live 2 floors down from you. 2 to 4 every Thursday, fine. Put your kids with me, I'll take care of them. I was like, blew my mind. That was great. This is how a community should be. This is how a community can work. And this is building on strengths, if anything, right, that the community has. So in many ways, that kind of shaped my thinking in terms of when we think about health and well-being, mental health. We often start with thinking services. Yes, important. But we have to start thinking community. We have to start thinking systems and environment itself. So that's what I will do in terms of my sharing. I'll talk about the journeys, personally, corporately, in terms of our office, how we are in NTU, how we are structured, how we work, and of course talk a bit about the lessons that we learned over the past 5 years or so. We're into our 6 years now, and maybe a peek into what the future is like. Yeah. Now, journey. Let me start with this personal journey. As I mentioned, not a clinician, not doctor, not psychologist, not counselor, nothing. In so many ways, layman in so many ways. So you can imagine how challenging it was actually for me to come into this role and take this on. Actually, in the thick of COVID, that was in 2020. But I'm thankful that in January of 2020, before the full force of COVID, my wife and I, we were approved as foster parents. Some of you may be aware of the MSF or fostering system, which was got into the news very much lately. Yeah. So we were approved as foster parents, and so we had to go through a compulsory training, 2 training of 6 weeks each. So, and it's through that training itself that it was my first, like I put here, my first contact with mental health per se. I've never thought about mental health as a problem. I've not had any issues in the family, nor friends or classmates and so on. But my first contact and learning about mental health issues amongst the vulnerable, the children, the kids in child protection, it blew my mind. I was like, oh my, there's this segment of our community that needs that kind of attention and help and support. And lo and behold, about May or June that year, I was asked from the Career and Attachment Office, and all my life I've been doing career development for students, employability work. And I was asked to say, the university is going to start an office focused on student well-being. Would you be willing to do that? I will tell you very honestly, if I had no experience with the foster, or no journey or experience with the fostering journey, understanding mental health and the landscape itself among the vulnerable, I would have said no. Yeah, because after I said yes, and I told friends and colleagues about, I'm moving on, to take on this new role, they were saying that, oh man, you don't know what you're getting into. That was their first response. You have no idea what you're getting into. But it is meaningful work. They'll end with that. You have no idea what you're getting into. I saw many nods amongst you. Yeah, you have no idea. I still have no idea in many ways. We are seeing interesting things all the time. But it is meaningful work. And that I will say again and again, it is meaningful work. And one more thing I'll share is my first encounter, the shadow of the first suicide case that I handled. Out in the cold. Freshly starting the office, starting to deal with students and well-being and so on. The first suicide case I handled, I was there. I saw it. The shadow still haunts me. It still haunts me. But it is something to remind me that for all of us who are getting into this kind of role, we need to be prepared. We need training. Not just that, we need support. We need the support, definitely. Sometimes people ask me, hey, your whole office, you carry the burden of the entire university, the things that most people don't see. How do you deal with it? How do you deal with it? How would you deal with it in your institution? Something to think about. Okay? Now, that's personal. So I switched gear a bit to the corporate side of things. I mentioned that we started in 2020 as the Office of Student Wellbeing, just dealing with student wellbeing side of things. So we have a counseling center, we have a programs team, preventive and proactive programming. We have a support and care team, which are first responders. When there are incidents, critical incidents on campus, we have boots on the ground, right? And we have a policy team as well at that point in time. At that time, looking after students only, we were dealing with 33,000. That's like, just now, what did Matt say? UBC has 72,000. I was like, wow, okay, we can go home now, okay. Yeah. 33,000 to me is huge already. I mean, I don't want to say it's a lot because NUS is here. NUS is bigger, actually, has a lot more students compared to us. So we were looking at 33,000. Already huge, right? Already huge. And then in 2021, of course, since 2020 itself, the university was, as with most institutions, we go on a 5-year plan, right? So 2020, we start discussing on the 5-year plan, 2025 plan. So in the NTU 2025 plans, the pivot was decided that OSW, which looks after only student, will become the University Wellbeing Office, which means that now we will look after staff also, employees as well. So our office looks after both students as well as employees. So that is 33,000 you can see over there, plus 8,000 employees. So that amounts to, bring out calculator, 45,000. So sometimes we, when I give talks like this, sometimes it's hard to, especially for foreign visitors, right? They will say 45,000. What is it like? Okay, the size of Aljunied, right? The size of Aljunied, around there. And you know that in a constituency like Aljunied, there will be not just one FSC or one counseling center, right? There will be multiple FSCs to serve the community in FSCs. But the whole NTU, we are one office, right? Just like whole NUS, there's one Health and Wellbeing. But what I'm very thankful for in 2021 is that we have this new module, also co-started by my boss, who's also here today. It's called a compulsory module for freshmen, right? Healthy living and well-being. This was a tremendous help to us all. Tremendous help. Why? Because as an office, we have to build awareness. We have to build skills. We have to build community. But it's very hard to reach out to so many people. Very, very hard to get the messaging out. Yeah, you can spend all the effort, campaigns, talks, emails, social media. Right? Easy to talk about, but a lot of hard work at the back end. Every event you organize is crazy. Right? And do students and staff read your emails? Mostly not. Probably half of them read, and that's good news already. Right? Some of the institutions that I talk about, I asked the Chinese university, they say, oh, probably about 30%, but they have WeChat that they add everybody in. Oh, I say, great, how do we do that? So they can get messaging very, very quickly as well. But for us, we don't do that. And so this module was absolutely helpful, absolutely important, because now, 4 years later, I can say that every student, undergrad at least in NTU, knows the fundamentals of health and well-being, how to take care of themselves. They know where the resources are on campus. They know where we are to look for help. Okay, so that's 2021. And then in the midst of COVID also, one phenomenon came in between 2021 and 2020. Our counseling center, some of you were during that time, I see colleagues, ex-colleagues during that time as well. A sudden surge of counseling requests from students came in during a specific time, during the semester. We were like, why? This is off cycle. This is completely beyond what our normal data shows. And guess what? It all came from one school. I won't name it, It came from one school within NTU itself. And we look into the data and we talk to the students, we ask our counselors, can you speak to the students? What's happening? And then they told us that, oh, all our assignments are due within the same week. 4 modules due in the same week. Would you be stressed? Would you be stressed? Would you be under a lot of pressure? Beyond that, in order to get the assignment done, they have to book a lab to do that work. And guess what? The lab's all jammed up. So even weeks before actually having to submit the assignment during the deadline itself, They have no way to get the lab. So they are so stressed about it. And so they all came for counseling. And so this was an epiphany for me and our team, because it speaks of the setting. It speaks of the environment that they're in. Of course, when you're a student, you're studying, stress comes from studies, academics, right? When we are working, we are employees, we are working, stress comes from your boss, the workplace, right? That's how it is. So, but we often think about well-being from services angle. Oh, we must provide this service. Yes, important, yes, but think setting, think environment, like the frog analogy that Matt mentioned just now. Important. And so in the year 2022, we started thinking about well-being consideration in pedagogy, because we feel that, hey, faculty members, for example, you see students almost every day, 3 credit course, you see 3 hours a week, right? You see teachers in our MOE schools meet students every day. Can you have a better impact than me? Yes. You would definitely, what you do in your classroom will have a much bigger impact than what my office or UWO or any health and well-being office can do. So we started thinking about that, trying to tell faculty that, hey, this is important and this is what you can do. These are some tools that you can consider. But it's a difficult journey. Many of you in this line of work will attest, because we don't make things compulsory. It's hard to make things compulsory as well. And so in 2023, Vivian, our Associate Vice President for Wellbeing, went to UBC. And that's how we got, well, at least for me, that's how I got to know about the Okanagan Charter. And when she came back with that, she was practically jumping with joy. They said, we found the framework. This is an important framework for us to hang everything that we do on, which is correct. I was very excited. We were all very excited about it. And so 2 years on, this year, we signed it. Our president signed it. And we are officially a part of the network, and established also the Singapore network. And so the universities and the polys and the schools, please join in. Right? This is actually very, very good and important. So now, today, 2025, compared to 33,000 plus 8,000, which is 45,000, now we are. Okay. Thanks. 45,000, even more now. All right, so that's where we are in terms of our corporate journey. Now, I want to tell you a little bit about this also. That's a funny story here. Around about 2022, I took a course on public health. Actually, you can imagine our work is actually very much public health. And during the course, I learned about this analogy, this story, which was very funny. He said, you know, this guy was walking along the river, and then found someone who was struggling down the river, screaming, kicking, and all that. So you are trained, you can swim, you can do first aid and so on. So you jump into the river, pull this person to the bank, and then some bystander came to help, right? And so as you pull this person out from the water, you see another one coming down the water, kicking, screaming, shouting, drowning, help. And then you go back in, you pull this person out again, right? And before you could finish doing that, another person, another 2, another 3. You're like, what the heck? So then after pulling, there are others who join in your effort, and then they pull all that 3 people out, and you see some more coming down the river, and then what would you do? You would get yourself out of the water, go upstream, and see who the heck is throwing all these people down the river. Right? Yes, we do what we can to save whoever is drowning now. You need the help now. I save you now. I help you now. Yes, but who is throwing them into the river? So that's another frame for me in terms of how we look at our work. Right? We want to go upstream. We want to do preventive work. And settings is very, very important. Yeah. Okay, so that's the journey, very, very high-level journey so far. And so what are some of the lessons I picked up? A lot more than this, for sure, but I just highlight a few for us if we are looking at systemic changes. I'm a teacher at heart. I've been in education since 2001 for a long time. So can we read this together? This is this is from Mr. Ong Yi Kang, our Minister of Health. I love this quote. I love this quote. Shall we go? 1, 2, 3. When healthcare is mostly treating sickness, it falls mostly. But when healthcare is about what? Creating health and caring for our people in their homes and communities, it becomes everyone's business. So in order to realize health for all, we also need all for health. It's cool, right? It's so cool. I so want to meet here and say thank you for this quote. You know, it has stayed with me since 2023. It's been 2 years now. I continue to use it and continue to remind ourselves that we need all for help. And that's why I remember my story with the HDB flats and social service and so on. Building the community as the resource itself is actually vital, right? Especially when we are looking at a large community. So this may be very familiar to all of us, right? This is the first thing we need to change when we come into this kind of work. That it is not just illness or sickness focused, but it is really health and thriving and positive side of things focused, right? Because not having an illness doesn't mean you're well. Not having an illness doesn't mean you are healthy, right? So that's important to remember. And I always show this because it has to remind us of what's possible to change. What are the determinants of health? I didn't make this up. This is from research. Determinants of health. How many percent is healthcare, the work we do, services that we provide, healthcare, 10%. Genetics, 30%. I tried very hard to grow more hair. For many years, medication, rub, alcohol, whiskey. Doesn't help lah. Anyway, my wife said you look more handsome now, so it's okay. All right, but what surprised me when I first saw this and baffles me is, wow, determinants of health, individual behavior, 40%, it counts for 40%. And what else? 20% social and environmental factors, settings. So altogether, what can be changed is 40% plus 20%, 60%. Can be changed. We can help our people, staff or students, make better choices day to day. That helps them with their health, help them with their well-being, help them with their work. That's our job. When I showed this, one thing to share, when I showed this to some visiting university, foreign universities, before I showed this, I said, okay, can you guess or make whatever you know of, determinants of health? One thing that came about was money. No money, no talk. So money determines, well, in many ways, money determines health as well, in some sense. Okay. So, but keep this in mind. So, the first lesson I would say is this. Thanks. I always remember to keep on learning. Like I said, I came into this as a layman. I had no idea what mental health is about, what health really is about, right? And the danger is for all of us, if, you have heard this saying that if you're a hammer, all you're looking for is a nail. Everything you look at is a nail. That's a danger for all of us who are professionals, right? So we have to keep learning, keep understanding more. It was a steep learning curve for me. Psychological first aid, public health, positive psychology, science of well-being, all the courses on Coursera. I have to go on and learn a lot on my own because I can't go and do a degree or there's no time for it, right? So a steep learning curve, you have to keep learning, be open to what's out there. There's a lot of research that's coming out still, which can be very helpful to our work. So this part is of course, the mindset of between health versus sickness. We have to start moving from the sickness model to the health model, to the thriving model, to the well-being model. Okay, determinants of health, I mentioned that. Leadership. Organizational change, leadership, of course, is very, very important, right? We did a lot of bottom-up work, grassroots work, community of practice work. We have peer helping programs. We have well-being advocates, well-being champions. We want units to take ownership. Cannot be just all your office run, my office run the thing. It's not possible. You have to own it. Every unit, every school has to own the well-being agenda. My colleague Zihao here did a lot of work on grassroots work, building up the community, training them, giving them the understanding of what well-being is about, what's positive education, what's positive psychology. But we need top-down, right? Matt showed you about how they are structured, who he reports to, his stakeholders, key stakeholders. Top-down is important because you need that advocate at the strategic level, university or institutional strategic level. You need the sponsor to keep speaking about well-being, keep encouraging others to come on board. You need that, definitely, right? Because it shapes organizational culture. People. The example I gave for myself coming in, cold, not knowing anything, having to learn, having to go through this very steep learning curve. Our people who come into this kind of work needs to be supported. Very much. Not just platitudes like, oh, how are you doing? Not just that. That's not enough. How are you doing? That's important, but it's not enough. Right? There has to be more. Our counselors, psychologists get supervision, clinical supervision. How about the rest of the people? Right? How would you think about supporting the people in this work, supporting the people who would push this agenda together? Right? That's important, which is part of the buy-in. Faculty, I mentioned earlier, it's very hard to get them to also think about well-being. We have some champions, but at a larger scale, it becomes very difficult because technically speaking, people will always say, not just faculty, that we let the experts do the job. Okay, so the buy-in itself, from down the line, everyone doing this work will make sure that the work progresses and is sustainable. All right? Policy. Just now I talked about people, right? So we need policy, of course, to support that, right? Your capacity itself. The training, how do you mandate training? Who needs to go through training, right? Where's your data coming from? And I'm not talking just about usage data, counseling, how many people come, how many critical incident cases a year, and so it's not just talking about that, but well-being data. How are your people doing? How are your students actually doing well-being-wise? How are your employees actually doing well-being-wise? Of course, we are also very concerned with survey fatigue. If we keep surveying them, they also like, oh, sian, another one. Is it for you or for me? Right? Sometimes if I get all these survey that the organization is sending, it's like, is it for you or for me? Right? So sometimes when we do the survey, I feel that what works for us, we use a PERMA profiler. What works is because whoever completes this survey gets a report. So it's for you as much as it is for me. Right? So something to consider in terms of policy level. And whether we centralize our structure or decentralize our structure, of course, pros and cons. If you don't centralize, there's a lot of soft power needed, a lot of coffee drinking, lunch, a lot of influencing. And then what happens is when that person change, that's it, do again. Right? Do again. Yeah. And sometimes it happens every 3 years. Right? Yeah. So that's one challenge in terms of policy side of things. Now, technology. We are a Nanyang what? Technological university. So don't talk about technology. Sometimes last time students say, hey, NTU, your technology, where is it? Technologies, we use technology. We have to. Because our population is big. How many workshops are you going to run? Yeah, you should still run them, but how many are you going to run in order to cover enough, right? So we use technology to scale our reach, accessibility, and so on. There are two I want to highlight. I tell everyone about this because we are not just proud of it because of its immense impact on our people. The first one is Intellect. We use the mobile app Intellect, which gets it into the hands of students and staff. They can access well-being programs at their own time, as any time they like. The beauty of it is that they can also access coaching or counseling through the app itself at their own time. They don't have to make an appointment at our counseling center, which now is peak period because exam coming, everybody rushing, you know, I want to have counseling, but so many people come at all at the same time, you need to wait. But if you use Intellect, 24 hours. Cool, that's the scale, right? The other one is psychological first aid training. You may have seen it in the media recently. We got into the Singapore Book of Records as part of the campaign. We started in 2022. Now we have trained over 4,700 people, students and staff on campus with psychological first aid. And that would not be possible without technology. Imagine one PFA training by Red Cross, 30 people, one session. How many you need to run to train 4,000? Right? So we use the app. Some of you have seen it. I hope you're as excited about it as me. Of course, there's room for improvement. It uses AI for skills practice. You look at the screen, you're actually supporting someone on the screen, which is an AI avatar. You say something, the person responds. You say something, the person responds. This is how you practice the skill. So that's what we are using technology for. Of course, resourcing. I don't have to say more. All of us have pressures on whether money or manpower. Our cases are also getting more complex, right? I see many counselors here. You know that our cases are getting more and more complex, comorbidity and so on. And there is a need to work together because as an institution, we are not designed to be service counseling or psychological services that deals with deep issues because the volume is way too high for that. Right? So we need to work with external providers as well so that we can refer students to them. Okay? So I'm going to end soon. The timing stopped already. So I'm giving a bit of grace. I hope it's okay for you as well. What's the future? Okanagan Charter. Limerick Framework for Action. Please have a look at it. If nothing else today, get out of this room, download the document, look at it. Settings, environment, it's a game changer. It will be a game changer for you. The key term, operative word is embed. It's not really about coming out with another thing, but look at what you are already doing. How do you embed well-being into it? I'll give you an example. Student well-being side of things, to embed, I mentioned already, how is the curriculum delivered in a well-being considered way? That's embedding. We have to train our faculty to do that. We have to get them onboarded, buy in to do that. For staff well-being, how do we embed? We need our leaders on board, all our people managers on board, yeah? Because they are the ones who will effect organizational culture change. I'll leave you with this. This is my last run already. I think 1 minute. I recently, my 1 minute very long. Actually, I wrote a book called about a 1 minute children's book, not for you. I recently watched a show called The House of Dynamite. No, nobody has watched it. All blank faces. It's on Netflix. It's called The House of Dynamite. Rebecca Ferguson, Tom Cruise's love interest in what's that show? Mission Impossible. Okay. See, I don't remember Mission Impossible. The show is about a nuclear threat that the US faced. Somebody has fired a nuclear warhead at the US. And so they have to respond. So the show is great because it shows that 20 minutes of threat from 3 different perspectives. The operational ground operational staff, the military leaders, as well as the president, the senior leaders of the country. Different perspective, 3 story arcs in that 20 minutes, each one of them. Different perspective, but one story. So I think about, when I finished that show, I thought about the perspectives that we have in NTU, in our society, as a country as well. The different perspectives, right, from our students and employees and our leaders and our board at the same time. So, but we have 3 perspectives, 3 arcs, but one main story. One single story. And guess what? That story is humanity. The story is about humanity. Go watch the show. At the end of the day, it's about life and death. Who sacrifices, who doesn't. It's about community. It's about humanity, the choices we have to make. And it says that we are all after the same thing. We are all after the same thing. I hope that you will take this with you. And that same thing is hope for a better life. Yes? We are all after the same thing. Our students are after that too. Why do they come to university? Hope for a better life. We are all after the same thing. But we have to work together to get there. We have to work together to get there. Thank you very much.